fractionated carbon dioxide ablative laser drills millions of tiny holes into the skin. These holes can go down to 1 millimeter, maybe 1.5 millimeters or deeper, but they're very narrow. Each one of these beams is about 110, 120 microns in diameter. But each one of these cylinders of damage or vaporization is surrounded by normal skin. And it is amazing how quickly these holes heal up. Probably within about 12 hours, these holes have all healed up. So, whereas the treatment itself causes a significant amount of oozing and some bleeding, swelling, redness, etc., really, when the time the patient leaves the clinic to the time they're fully healed, they have very little discomfort. They're at home. It's definitely a downtime procedure, probably 4 or 5 days. And if these patients catch their reflection in the mirror, they're going to see that they've got some serious injury going on, but they feel fine. They're on the phone, they're on the computer, they're around their workplace if they want, but they can't be out in the public during that time. But they feel fine. There is no pain or very little pain, and the wound healing is very fast.
What areas of the body can be treated with this?
So traditionally you're treating the face, because that has lots of adnexy, hair follicles, sebaceous glands, sweat glands. But with this device you can actually treat off the face. It's what I called an underprivileged area, the neck, the chest, because it has fewer adnexal structures.
What's the typical treatment time?
In terms of doing a full face laser abrasion with the fractionated CO2 laser, it probably takes me about 35 to 40 minutes. But I tend to get patients in about an hour earlier. I'm impressed with these fractionated systems, how well the skin heals up after the treatment, so that after 4 or 5 days it's completely healed up and the patient's had very little discomfort.
How long until your final result? And just kind of give me an idea, you know, as far as what my social downtime is, what my real downtime is, what my social downtime is, you know, and what my stages of healing are going to be back to where I'm normal and then back to where I get my final result.
Yes, social downtime, basically, the women out there who can use makeup will probably be able to put on makeup at about 5 to 7 days. So actually, realistically, you can get back to work at 7 or 8 days. The guys who tend not to wear makeup, they can pass it off as just being like a weekend sunburn that they've got, but they will still be red. And if you have been aggressive with these devices, you will have persistent redness for 2, 3, or even 4 weeks, and you might have some swelling as well. Now, in that regard, it's important to note that the more aggressive you are, the better the result that you will get. So now there are some companies out there that will use very low energies and very low densities, and they get very little reaction, but they say, hey, this patient's healed up in 24 hours. Well, I will say, wonderful, no redness, no result. But you ask the question, how long does it take for the final result? And I will tell you that we get continued improvement at 3, 4, 5, 6 months. Up to about a year.
Just kind of explain to me post-op appointment time. I mean, do you need to see somebody the next day, within a week, and then how many follow-ups are typical?
So I will see patients usually at 48 hours and then at 1 week. And after that, I will probably see them at 1 month and 3 months. Now, it's really important these patients all have my cell phone number, or they can contact one of my healthcare professionals at any time of day or night, because one of the problems with any of these procedures is that you can get infections, you can get complications.
So in Orange County, California, what is kind of a range of what a patient might expect to pay for this treatment?
I charge $5,000 for a full face and $6,000 for a full face and neck. There are probably other people out there that might charge less, and on the East Coast, my good friends in New York, I'm sure, charge significantly more. And I think cost is important, but also I think patients need to be confident about who they're seeing, the experience that the individual has had, and also about their nursing staff and other assistants. They want to feel as though they're treated by somebody who's well informed and has had the technique down, so they can deal with everything, etc. And at the Dermatology Center, University of California, Irvine, we have probably more lasers than anyone else on the West Coast. We do more research than anybody else on the West Coast, and we have the expertise. So I would say that patients in our clinic are going to be in good care.
Is there anything that you can use this in conjunction with, or is this a standalone treatment that needs to be done?
Oh no, we're using this in conjunction the whole time. If you just tighten the skin, you're just tightening the skin. You're not necessarily rejuvenating the appearance. The combination of treatments, I think, is critical, and for the patients to get the best results, they have to see somebody who's had the experience and who can actually use all these things interchangeably. One of the problems about a patient seeing a physician who has one laser is that the likelihood is that they're going to recommend that particular laser for the treatment, whatever it is. If you go to see somebody who's got 20 different devices, then they have choice, and they can optimize the treatment for that particular individual.